You're on.
Thank you.
Okay, we're on, are we going? Jesus.
Thanks, Greg.
Good. Okay. All right, so this is our briefing for the week of April 13th, 2020. So due to the COVID proclamation by the governor, just want to make sure that everyone knows that the meetings are prohibited and that we are following the guidelines of our Attorney General as far as the open public meetings, our requirements for those. So after we get all of that out there, let's go ahead with Frank. Oh wait, let's go around there for introductions. Almost forgot.
Kevin Chudy,
Dave Windom,
Renee Kohler.
Jennifer Byerly.
Deidre Cameron,
Randy Nevlin,
Sharon Trask. Frank Pinter.
John Walsh.
All right, and Jennifer
still
dropped
not
off.
back.
Jennifer dropped off and hopefully be able to get back on. Diane, if you could maybe give her a call and let her telephone conference in. If for some reason she can't get the internet bandwidth to allow her to participate on the Zoom.
I bet her, I'm wondering if hers is as bad as mine is.
So, and with that, I wanted to
Hey Jen, it's Diane at County.
Hi,
I got kicked off the Zoom and it's not letting me back in.
Yeah, so we're calling you, so we'll just do it for you via teleconference, okay?
Okay,
So
thank you.
we're in live briefing right now.
Perfect.
perfect, thank you. Commissioners, I wanted to change the agenda and put this item first, which is to discuss the public service grant under CDBG. So because of the COVID-19 pandemic, the Department of Commerce has offered for to Mason County an additional just under $127,000 of funding that could be utilized under the public service grant. And both John Walsh with the Community Action Council and Jennifer Byerly from the EDC have brought forward a proposal on how to use those funds and how to make them available to the citizens. What I also wanted to make the board aware of is the fact that the board can use these funds in a way that the board decides to use them. So you have three options here. You can utilize the Community Action Council program. You can work with the EDC on a proposal that they have put forward, as well as put a proposal together of your own. So with that, maybe Jennifer, if you would start off and describe what your proposal is, and I hope commissioners have her document in front of them.
I heard Jennifer and that was about it.
Jennifer, do you want to go ahead and tell us what your proposal is for the grant?
What we're looking at is a potential micro grant grant program for businesses that fit within the requirements of the CDBG, which is 1 to 5 employees, have been in business for 2 years. They are low to moderate income, which is about $45,000 in our county. It's 80% of low to moderate income. You're looking at businesses with an actual physical location. I sent you some of the guidelines that I pulled together over the weekend, but it's building on the work that Commerce is already doing with their Strategic Reserve Fund grant, looking at the number of businesses that we received applications for. More than half of those would qualify for this. And the parameters around it really are commission-based. Through CDBG, you can loan or grant up to $25,000. I don't think we need to go up to that per application. It is set up as a reimbursable grant, so they have to show the need and where they would be spending that fund that they would be receiving. We have plenty of businesses that fit within those parameters. The goal really is to kind of stopgap help them until their additional funds can come in from either loan or grant opportunities that they have been searching after. As you can imagine, the backlog at ESC for unemployment, the backlog at SBA for loans, and for the Paycheck Protection Program that they're looking at weeks out. Some people are receiving their funds now that were the first responders, and that's been about 3 or 4 weeks. So we're looking at that again for all of the businesses that are now applying. So that's kind of it in a nutshell. We still go through an application process. We would still limitation on how they would be spending the funds. And on the flip side, the county would be getting that information as well.
Do you have any questions for Jennifer?
Jennifer, Kevin Schutte here. Appreciate you taking the time this morning. You mentioned that it could go up to $25,000. What would you anticipate would be, kind of the average grant that you would distribute? I mean, would you have in mind a lower cap? And how many businesses ideally do you think would be taking advantage of this so that the money can, I think one of the things that I would be concerned about generally with this is that we grant out the money and it sits, it doesn't get into the hands of people who can use it. What would your process be to make sure the money gets out there quickly, and then what would you anticipate the average grant being?
I think that the nice part about Commerce already having launched their grant look at a potential of between 7,500 per just average amount. It really would depend on what we would talk with the county about what would be covered under those reimbursable expenses. So if you're talking, let me get started with my screen. Rent is a big one. The Commerce grant can't cover salary. I haven't checked with CDBG on whether or not that can cover salary expenses. So I do still have some more work to do with them on what these grants can go toward. They can go toward marketing to get the business back up and running. They can go toward equipment, or not. They're not eligible for equipment. I apologize. They are eligible, I believe, for sure on rent, supplies, utility bills, things of that nature. But we can pull together a pretty detailed list on what the funds can be reimbursed for. So if we don't do a different application process, if we modify what Commerce has done, then I would see, it would depend on when the county can release the funds, but as soon as they release the funds, we would be contracting with the business, and they could immediately go as soon as we have their listed expenses that needed to be reimbursed. So the funding would potentially be out into the community, depending on how long that took, between 2 to 4 weeks, probably.
Thank you.
Okay. When does the county get the money? Do we know?
Well,
I don't know. I think that's a great question. It depends. If we're talking about the additional funds, that I don't know. I believe the county already has
is that volume up on the
potential
laptop as high as it'll go?
As high as it'll go.
other funds that were attached to a contract already.
But now you're going through the phone, right?
Just for one, because she fell off.
Okay. So you still want me to set this up?
It's good. They're just not talking right now.
Okay, but I mean, do you still want me to set up the
The speakers?
speakers?
Is it loud enough for the recording? Diedrich? Are we loud enough for the recording on
Her
here?
friend's talking? Okay.
I can hear
Microphone's
on,
right there.
Okay.
Oh,
Well,
I can hear through the Zoom.
okay. I don't
Yeah, I can
see-
hear it fine.
Yeah, I don't see a need.
Okay.
I guess we're okay.
All right.
Thanks for running back and forth for us.
Good try, Ryan.
It's louder if I need to as well.
You're okay, you're still laughing.
Thanks.
Commissioners, I didn't hear the question. Was the question, when is this funding coming available?
Yeah, when will the county have the funds?
So we have 60 days from the date of declaration of a disaster to respond back to the Department of Commerce on a scope of work. So we're kind of at somewhere within the next 50 days.
What is the expectation of when, after we do our application, that the money will come in for these
Money's
grants?
already been awarded.
So it's already in the bank?
I know.
Well, not technically in the bank, but it's available to be drawn down.
Yeah, we have to request it
Yeah.
to Commerce,
Yeah.
and then they will reimburse us for whatever the request is. So if they're approved through the EDC, and we get the appropriate paperwork, we would send that to the grantor, and they would send the money to us, and then we would give it to the EDC, so.
And that process takes about how long?
I mean, it's actually fairly quick, really. It sounds like a lot, but as soon as we get it from the EDC, we would send off. Commerce is pretty quick. I mean, I would say a couple weeks to a month long.
Okay.
Somewhere in there.
But does the request need to go on next Tuesday's meeting, or are we done with that? Did Frank sign the paperwork?
That part, I think Frank had asked that question about if this needs to go on, I would say it would need to go on the meeting, but Frank might have a more detailed.
So the funds have already been appropriated. This was kind of a unique program from the Department of Commerce. They sent out an email about 2 weeks ago requesting that, or identifying those counties that will receive extra funds. And if any of the counties did not want those funds, they had to send a letter back to the Department of Commerce saying, we don't want them. Well, obviously, we didn't, so we've already been awarded the dollars. All we have to do is put forward a scope of work that the board has approved as to how to spend those funds, and then we can draw it down based on that program.
So that would need to go on the agenda then for Tuesday, most likely.
The scope of work?
We would have to put this work in front of the board, yes.
Okay, so that's
If we
next
could put it
Tuesday.
together by Tuesday, then we can do that on Tuesday. Which would mean we need decisions at the end of the briefing today.
Okay. All right,
on how to proceed.
shall we have John? John, do you want to
Sure,
fill us in
Sure.
on your idea?
sure, absolutely. I sent you over kind of a lengthy email, and I apologize for that, but it's me. Gave you kind of a background of who we are, but you know that. Our model is essentially very, very simple. Take the entire amount of funds, divide it up between Mason and Lewis County, which is something we have to consider as well, or you do. So how you want to do that is up to you. Our model just takes it as a population split. Or if there's any other split that you folks feel is more appropriate. With those funds, 100% of them will go out to families in need. We're not taking any of the money at all for service, for our operations costs. We'll cover all that. So 100% of the money is going out to families. The model I sent along as an attachment pretty much lays out the program that we have with United Way here in Thurston County. We've developed and had developed in the past an MOU that essentially says when there's a community disaster, they'll raise the money, and because of our experience, we'll get it out to the families in need. You can see the qualifications that are there. What we're looking at, 200% of poverty. It's a one-time level of assistance, and it's pretty much what they determine they need. By working with us, I noted in one of the advantages, we can align this program with other programs. We have utility programs, we've got some rental assistance programs, we've got water, sewer programs. So we have some other programs in place that we can direct people to, so we can maximize the use of this money. Obviously the documentation and all that stuff that's what we do. So none of those are an issue. We've been running this in Thurston County now for approximately 2 weeks. We're seeing average of 25 calls a day. Average cost service is about $1,000 per family so far. And again, it's a one-time level of assistance, and there's really no ceiling on it. Again, it depends on the family, depends on if they what they qualify for, and that. You know, Jennifer and I have talked about our programs, and you know, we're both concerned with the health of the community right now. We just have a different perspective on getting there. You know, I look at this more of as a medical model. We've got a crisis, we have a problem, we've got to take care of the emergent needs. I call it the ABCs for my mountain training. You know, I've got to take care of what the issues are, and then we can move on to hope to intervene and prevent those kind of issues. So, you know, I really appreciate you sitting and deliberating these issues. I respect whatever decision you need to make. I also understand fully that there's needs within the county itself and county government you may need to consider with this, because you've got a health department, you've got some big issues to deal with, which I'm fully respectful of. And I just kind of look at it, you know, I'm a mountain climber. There's a lot of paths up to the top, and it's just up to you folks to choose what you feel is the best to get there. So I'll entertain any questions. It's pretty simple. You give us the money and I start spending tomorrow. I mean, it's pretty simple.
So, John, how many calls do you get from Mason County? I see you said
we
you
haven't
get
got
about...
a lot yet directly related to COVID, because we're still negotiating with the extra funds to come over to Mason County.
What about Lewis County? How many calls do you get from them?
That one just started. I can't answer that question.
Okay.
We're still getting a ton of calls anyway, because we've managed to keep our shop open, and I've got people, anyway, we've got bodies all over the place trying to operate. So we're still serving clients, we're still keeping our numbers up. Our demands for services are going up in all 3 counties. And we have new populations asking for service, which is kind of a challenge. But it's okay, it's okay. We've managed, we've got the capacity, as long as I keep people healthy, you know, we're in full operation.
Okay. Any questions for John?
John, how quickly do you turn the money around to people when they request it?
As long as they're qualified, we can get it within a week. Yeah, we turn stuff around very quickly. They turn it in, we'll pay it. Remember, it's that fast, and then we'll bill you guys, you know, once a month or however you want to do it.
Thank you.
May add to that, Commissioners. There are 2 other items related to this. If you remember, we have the microenterprise CDBG loan or grant, and that was the grant where we de-obligated $90,000 of funds because the county doesn't want to, quote, become a bank. I'm working with the Department of Commerce, and am going to be re-obligating those dollars, because the Department of Commerce has offered those dollars to be 100% forgivable if we use the protocol or the criteria that we developed as part of the original program. So they have to meet the same set of criteria that we have as part of this CDBG grant, and have $90,000 available to loan, but as a forgivable loan, 100% forgivable loan under that program, And the scope of work requires that one of the commissioners will be on the board making decisions as to who gets those based on the applications. So that's one additional piece. The other additional piece is that the Community Foundation Fund has requested a donation from Mason County. I believe we sent out an email with the request to each of the commissioners. Thurston County had donated $75,000 to the Community Foundation Fund from the $2163 that the county collects for the homeless from the process of recording deeds and titles. So the county currently has, or will have at the end of this year, an ending fund balance of about $340,000 in that fund. So the county can make a decision on whether it wants to donate to that fund as well. That also would be used to help citizens within Mason County. So those are two other sources of resources that the board can, already has access to.
So I have, just to clarify, so the 126,878, we are to share that with Lewis County, right? And then the 90 is just for Mason County?
I'm sorry, didn't hear that. What?
So the 90,000,
Is just for Mason County.
so the 90,000 is just for Mason County? And the
Correct.
126 is to be split with Lewis?
Correct.
Okay.
I can't even see, there we go.
You want to borrow my glasses?
Well, no, it wouldn't come up the
Oh.
cursor. At least on this, on the computer, I can see.
There you are.
Oh, okay. The 2163 is just for Mason County as well. The Community Foundation Fund.
Oh, okay.
What we give out of the 2163, if we choose to give out of the 2163, is just for Mason County.
Correct.
Okay.
As well as the micro enterprise 90,000, that's just for Mason County. And the 127,000, that's split between Mason County and Lewis.
Okay.
50/50?
John, it's based on,
I think the safest thing to do is just, we can take the populations of both counties, and figure out the percentage for each county and split it that way.
I thought that there was another option as well as to do 50/50.
It's your call. I'm just figuring out, we've used, we have money for the counties. We've used total population. We've used low income population per county as a percentage, where this is hitting 200%. If you went 50/50, that's really a scrap between you and the Lewis County Commissioners. However you want to do it is
Small
fine.
amounts, we'll need to scrap, I don't think. Just go by, what they're at 78,000, we're at 64 according to 2017 census.
Yeah.
We can scrap over 10 grand or be peaceful.
Great.
What do you think?
So,
Yeah, if I was asked to advise you, I'd say just split it by percentage, because it's not that great. As was just pointed out, it's a few grand. But anyway, I'm not in the game, so sorry.
question for Frank. So
Yes.
is what it sounds like the 126 is decided, maybe outside of our control a little bit. The 90 would go back to the EDC in forgivable grant/forgivable loan, correct?
well, the 90 would be through the micro enterprise, that through the E4E group. And that would be strictly 100% for Mason County citizens.
Of which one of us commissioners would have to serve on a board to determine how and who gets that?
Correct. And then you have,
I'll volunteer.
if
I don't
you
have.
donate to the
I'm
Community
one shy of
Foundation
days.
Fund, they would also service all of those funds to Mason County.
Say that again?
If you were to donate to the Community Foundation Fund, they would service all of those funds to Mason County.
And that's the 300.
No, that,
It would be coming out of the 300.
yeah, it'd be, so if we decided to give, Thurston gave him 75, if we decided to give him 75 or 50 or 100, it'd be our call on what to do, and that would go into their pot and they would disperse it.
To Mason County.
Yes, and only make it Mason County.
So with that, I would probably recommend being in the 30,000 and splitting, you know, maybe 50-50 north and south to start on that one.
I always think I'm the cheap one, but you're proving me wrong. Because I was thinking 50, but right now I'd rather see it go. So I just want to see it happen. So
Yeah, I mean, I'd go 50.
would you go 50?
Let's
Feel
do
like we're
50.
okay.
Let's do 50 then. It's all and 25, and
Yeah.
I think that's wonderful. Thank
Good.
you, everybody.
Yeah.
Okay, with those funds,
Okay.
Reading his lips, it looked like he said something else.
That's in the thought bubble.
Yeah,
audio is slow.
yeah, it was a little bit. Looked like you were cussing at us for a minute, but that's all right.
Just real quick, back to the.
What I understood was $50,000, 50% north and south for the Community Foundation Fund.
Except for Kevin was still asking a question
Just
on.
one quick question. So that 340,000 ending fund balance projection, does that take into account any new, I mean, is that fresh?
Yes,
Okay.
that is fully grown up and fully encumbered. And
But it takes into account the current, but it takes into account, is that a new projection based on what our new economic reality is gonna be versus what it was when we budgeted that way for 2020?
yes, and that's based on a conversation or an email conversation I had with Casey Bingham.
Okay. That was initially why I said 30, because I didn't know if that was.
Nope, I got you.
So, but if that's where we're at, then I think 50 is good.
Then how does the board want to proceed on the public service grant funding?
So that'll be divided by population, right? So we just need to decide who gets what?
So the decision is to go with the Community Action Council?
No, who to give it to, yeah. Go ahead.
I'm still trying to figure out, so we don't get 126,000, we get a percentage of 126,000, of which then we have to decide what percentage of that percentage goes to the CAC and or EDC. Is that correct?
So, yes,
And I'm supportive of it going here to the EDC personally, rather than going to the Community Action Council.
So it's I mean, I tend to agree, I just don't know what the, you know, if there was some money we could give to the CAC and then have the remainder go to the EDC.
So we can.
But I guess I don't have a good sense for what the breakdown is gonna be though,
Yeah.
of the, you know.
and if I may, you can decide half of it to the EDC, half of it to the Community Action Council, and then they each would have to split between Mason and Lewis.
If it's too hard to explain, it's probably wrong, just saying. What do I got? I got 1, 2, 6.
Divided by population.
Yeah.
So,
It's gonna be roughly.
So in either case,
50,000.
Mason, in either case, Mason County will get about $65,000, of which you can split between Community Action Council and EDC.
Now, I started on the Community Action Council, you start on now, for the most part, they're very good in their areas, but they don't do as much over here as I would like. And that's one of the things that I worry about there. If, you know, I wouldn't want to give them more than a third personally. I'd rather see all of it just go to the EDC, because it's right here, our people will be handling it right here on the ground, but at the same time, I understand you guys' concerns. What do you think?
Yeah. And that's why I asked John how many calls they get from Mason County. Because if they're getting a lot of calls, then I would say absolutely.
But they're not,
Let's
and they're a wonderful
send
organization,
in-
but,
yeah, they are.
but we
They're
don't,
amazing.
they just don't get the direct input from here as much.
Right.
Well, we serve a lot of people in Mason County. I mean, we're in the thousands over there. So the issue about, whether or not we're serving the community is moot. And you've seen the reports, and we're serving an awful lot of folks over there. So, if your decision is based on a longer economic model, in trying to support the business, I have no issue with that at all. And I respect that, as I said. We're just coming at it from a different perspective. I'm just, I've done emergency response in the mountains, and we're cleaning up the blood right now, is what I look at. Will all that money go to Mason County? Absolutely. Will it go out quickly? Absolutely. Will we have calls once we announce it? Absolutely. We'll have no trouble spending the funds. So I guess as you deliberate, whether or not we'd serve the community is kind of a myth to me. I've been working here for 40 years in Mason County on a lot of stuff.
I don't think our.
So I would.
I don't think that we have any doubt that you're definitely doing a great job with both Commissioner Netherland and I.
Sure.
Commissioner Netherland already served, and I'm currently serving.
Correct.
I know you guys do wonderful things, so it has nothing to do with whether we think that you're doing a great job in Mason County or not, as far as I'm concerned.
No, and same here, it's more of a direct connection that's right here on the ground, easy for them to access and work with, especially if we can get it some type of economic development aspect of it.
No disagreement. I think in my comments, I certainly appreciate that small business is the driver. I've been doing this for 40 years, and I really understand that. Without these folks in town doing the work, we don't exist. That's your tax base, that's your community. So I fully respect that. I have no issue with that.
So John, I understand, I know, the work you guys do on the food banks and stuff like that. What about the senior centers? I don't remember. Do you guys help them if you were to have some of this money, could they access some of that money through you?
For seniors, yeah, absolutely. Yeah, absolutely. Yeah, we serve, who gets the service is not a question. It's how long the money's gonna last. That's all.
So I'm still good with 1/3 and 2/3.
Yeah.
But, you've got, like I said, I respect your decision. You're in a terrible spot right now. You've got a mountain of issues and a fire hose of stuff coming at you. And you just gotta do the best you can. Yeah. And I respect that.
So, kind of where maybe I was thinking maybe a little bit different split than what you were thinking there is, I was thinking at least 50,000 to the EDC, because if they do a $10,000 cap, that's 5 businesses, and then the remainder to the CAC. I don't know what that percentage splits out at, but
Well, between 10 and 15,000.
yeah. So
I can actually go with either one of those, because again, I believe that what will end up happening is a lot of our seniors will end up accessing that money through them, where they can't access it through the EDC as much. And I do know that those, right now, they're dropping and they're asking for money of these other organizations that we're talking about giving money to. But they'll be one of many, where more of a direct pipeline. That's what I'm thinking for these folks. But I can go either way. I'm actually completely open to either one of them, as long as they have something to be able to access for our seniors. So I'm going to call them. I'm going to call them and tell them when we leave. This is where you need to make a phone call.
Okay. Well, I kind of lean toward what Kevin. I think our small businesses are definitely the backbone, and they're the ones that are employing the people that need the help the most.
And I agree.
So
make it happen.
Okay. So did that make sense?
Yeah, so 50,000 to the EDC, remainder to CAC, of our portion.
Yeah.
26,878.
Did you guys hear that?
Yeah.
I didn't.
No, you printed.
Jennifer will fill you in.
50 to the EDC, the remainder.
Got it.
Good.
Cool.
Perfect.
So that will have to go on next Tuesday's agenda then, because that'll be the work plan for that night.
Okay.
Thank you, Commissioners. We'll put something together, and hopefully I can have it on the action agenda for Tuesday.
And the same with the money from the 2163?
Yes.
And then what about the 90?
Yeah, what about the 90? How are you gonna set that up? You gotta set up a committee, or is the committee already there that we need to put a body on, or what do we have?
We have a scope of work that we're finalizing in the next day or two. I did not sign the de-obligation 2 or 3 or 4 weeks ago, so we don't have to make any change to the agreement with the Department of Commerce. All we have to do is to agree on a scope of work as to how those funds will be distributed, and the distribution process will utilize an additional member on the board to review and authorize the grants, and that person will be somebody from the Board of Commissioners.
On what board?
The underwriting board that was set up as part of the lending program. If you remember, Enterprise was going to have a lending process. Yeah. And on that, we had developed a board that was made up of one of the members from one of the community banks, the E4E, and then we would add an extra board member on that. But there's no process that the board has to authorize, because I never signed the de-obligation document. All we have to do is to process a schedule of work,
So do you want
and
me
that
to?
would need to come in front of the board.
He's okay, are you okay with me? So go ahead and set up the appointments and put it on my calendar. I'll be the one, and we'll just get in there and we'll get that stuff working.
Sounds great.
Now, we're gonna go by the same guidelines that was originally set up, so it'll be just like the cash program I worked with many years ago then.
Exactly.
Okay,
Yep.
I already have experience there, so
Yep. The
that's,
only difference in what was the original proposal is that the funds are 100% forgivable. Thank you, Commissioners. John, Jennifer, thank you.
Yeah, thanks a lot, appreciate it. Hang in there.
Thanks, John. Talk to you soon.
Yeah.
Thanks, guys.
Thanks, Jennifer.
Okay, I'm hanging up, Jen.
she waited for her to talk like that.
Yeah.
So the other item that I wanted to kind of add into this, if I may, and I see Renee sitting in the back and trying to answer her question, there is a Mason County Family Recovery Court expansion grant that runs from 2019 to 2024. So there's an extension request that requires an attestation letter to be signed by the chair. And basically what that is saying is that the budget as proposed in the original grant application has not changed more than 25% from what was presented. And that is the case, is that grant budget going forward into the next cycle will not change more than 25%.
Are you comfortable signing that?
Yeah, can we all agree to it?
Yeah.
Absolutely.
Yeah.
Yeah.
The only problem is, we can all agree to it, you're the one on the hook, so
Well, I'm not gonna sign something that you guys
those
disagree with.
those attestations,
So that'll go on next Tuesday's agenda.
Yeah.
That'll be official.
The budget's not gonna change more than 25%?
Will not.
Okay.
Is that a problem?
That'll be on the stage as well.
Thank you. Great.
Thanks, Renee.
Thanks, Renee.
So then we have the draft letter of notice to the employees in regards to the partial county closure. And that is a draft of a document that we would propose sending out to all the employees so that when we get back to work status, what the options for options for staying at home, options for unemployment, options for paid medical leave or sick leave are that the employees can anticipate. It gets kind of technical, but then again, the CARES Act and the Families First COVID Recovery Act is pretty complicated. Now, in addition to that, the support services team is looking at a follow-up letter that would define the physical protocols for back-to-work status. And Dave, I see you in the background there. You and I haven't had a chance to chat, but I saw your PowerPoint presentation in regards to phase 2, phase 3, and phase 4. That's what I would utilize as a basis to get that other a letter to the employees. Because the question is going to be, how do employees come back? Do they come back wearing masks? Do they come back wearing gloves? Do they come back and are required to have 6-foot intervals? And that's kind of a moving target because we haven't had adequate guidance from the CDC or the professionals. So I'm going to be working with David on how to put that forward to the board and then get out to the employees.
Yeah, it's a moving target.
That will probably be different depending on what type of an environment you're in. I mean, Public Works truck drivers and the treasurer's office and the courts will all have different environments that we'll need to address as to what that would require from a protocol standpoint, as well as what types of PPE we have available. So one of the questions that I have for David that, again, I haven't had a chance to ask him is, does a handmade mask suffice as opposed to a surgical mask? And I know Mason General is using handmade masks. But how often do they need to be washed? Who's going to wash them? Those kinds of questions. So Dave, you and I have to go through that process.
It's kind of a moving target.
It's
Always
getting easier,
changing.
yeah. So I did come over last week and supplied everybody that was here with masks.
Yeah, you look like a duck, but you have a mask.
Yep.
So on the document that's in front of you, if you want and get back with some edits, I'd appreciate it, and then we could move forward with that.
I read through it. A lot of it goes along with what Summit Law is suggesting that we do too.
It's basically from their recommendations. Or not recommendations so much, it's their interpretation.
Right. Of what we have to do.
Correct.
Have Tim or Mike looked at this?
I'm sorry?
Have Tim or Mike looked at this?
Not yet.
Okay.
Any questions?
So I will ask that you forward any comments or changes, and then we could move forward with that document. I don't envision this happening within the next week or so, but we need to finalize this as well as the back to work protocol document, which will be coming shortly.
Sounds good.
The next item is the medical emergency disaster leave sharing policy. So that's part of what would happen in a back-to-work environment, if an individual is exhausted all of their medical sick leave and has to take time off for care of a child or care of somebody with COVID, they would have the ability to utilize the federal programs, or because there's a medical disaster, the IRS gives exemptions or tax liabilities to those that donate leave time. The normal tax environment for leave that's donated requires the donor to pay taxes on the dollars they donate. This relieves that and allows for those donations to be taxed on the person receiving the shared leave. The budgetary impact to that policy is that as this is utilized, current expense or the department that uses these shared leaves would have to come up with the funds to facilitate the leave. However, since we have everybody budgeted, there wouldn't be extra dollars required as part of the budget to authorize these transfers of leave.
Any questions? Okay, looks like there's no questions.
Okay, then we'll move that forward to Tuesday as well. And then that would be in place for the back to work period, when everybody comes back to work, and we can then do a leave sharing policy without tax implications to the donor.
Sounds good.
Okay, and then I think the next item, Jennifer, is grant funding opportunities.
We already covered that.
You did, excellent.
Yes.
And how about March financials?
Yes. Okay, so we have the March financials. And starting out with the revenue on page 2 for current expense, we are looking really comparable with where we were last year at this point in time. The difference, last year we were at 19%. And this year we're at 18. The main reason for that is the indirect payments. Those were pulled out at the beginning of April, so those will show up in April instead of March. So otherwise we would have been at 19% of our budgeted revenues for current expense. Looking at, taking a closer look at the treasurer's revenue. Last year we were at 17%. This year we are at 17% of our budget revenues. We're slightly higher at 4.349 million. Last year we were at 4.2 million. The property taxes are just slightly lower. The property tax collections are just slightly lower than they were at this point last year.
Do we know what the amount of extension requests the treasurer's office has received so far?
I don't know that, but I can ask her and find
Check
out.
like that.
Yes.
She said 46%
We're
is
escrow.
yeah.
So what percentage of the 54% are
Right.
asking
Yeah.
for extensions, I guess?
Okay, so we'll find out. Are there any
Did
questions?
did her order, and then I can go back and look, if you know off the top of your head, did her order stipulate that mortgage companies couldn't put in for the extensions?
I don't know that, but I'll ask her that question also.
Actually, it wouldn't matter, 'cause she said take it on case by case, she gets to say no.
Yeah.
So maybe instead, we rephrase that to, we're requesting that she not consider those.
I'm good with that.
Yeah.
Yeah.
Thank you.
So moving on to the expenditures. Last year we were at 23% of our budgeted expenditures and current expense. This year we're at 24%. Again, that has to do with the transfers out to other funds. Last year we had only transferred out $75,000. This year we had transferred out $615,000. So that's the main reason for the difference. So nothing to be alarmed about through March. One thing I did want to point out and possibly change for next time is on the sheriff expenditures for traffic policing. Really, their budget is $2.16 million for the traffic policing, but we show it in Munis as $2.6 million, and that has to do with the ratio that the traffic deputies and the patrol deputies are charged out, and so they have vacant positions, and so anyway, I've talked to the sheriff department about that, and they're comfortable with me showing the expense at $2.16 million and shifting the difference into the sheriff department fund. So if you want to see it that way, I'll present it that way next month, because really they're at
I
about
understand
26.
that. I think we're all comfortable with you doing it, the way you're doing it.
Okay,
Because we're getting pretty used to that one.
Changing it, okay, great. Yeah, because it makes it look like, they're only at 21% through March. Well, really, they're at closer to 26% through March, so it'd be a more accurate picture of that. So, okay, great, I'll change that for next time. One thing I forgot to point out on the revenue for DCD, you had asked me last time why it was so much higher, and they did receive just an influx of a combination of residential and commercial permits, just higher than they were last year. I think last year they had a $10,000 WIRA grant, or maybe that was this year. Anyway, I forget what. Anyway, that it was immaterial. So the main difference was in their revenue was the influx of permits is higher. Yeah. And last year we did have the Snowmageddon too, but I don't know if that really has an impact there. So huge on the difference. Huge. Okay, so maybe that was why they're higher this year as well. So moving on to the specific revenue streams comparisons. We are higher on the community development revenues again, obviously, and then the detention and correction services slightly lower than over the past 5 years. The property tax collections are slightly lower, showing in the road diversion and county road current expense property taxes, but not a substantial amount at this point in time. The sales tax is actually quite a bit higher through March than it was in the previous 5 years. So that is great.
When does that, because the business are given an extension now, when will that hit us? When will we see that? Do you have a month?
So normally we receive the sales tax 2 months after. So my understanding is that the extension is for, I think it was 2 months. Is that correct, Frank? 2 months? Okay. So we will, I would expect we'll start to see an effect in May, probably, and then it will go pretty low through probably August at this point in time.
Okay.
Everything else besides lodging tax was just slightly lower, but everything else is slightly higher on this sheet than it was last year or the previous 5 years. So any questions on these? Okay. Page 7, the sales tax. We are at close to 1.5 million through March, which is, again, everything is higher month to month over month, January, February, March, than last year comparing to 2019. If we were to continue on this type of route, we would most likely see 6.6 million in revenue from sales tax, but obviously that will not be the case.
We're probably gonna come up 500 grand short. Are you, what do you?
Muted.
Can't hear you.
You're muted.
Yeah, at least.
Okay.
At least.
So any questions?
Because it's been,
I meant 500 grand short of our budget, not of that amount.
at least.
Okay.
Again, they deferred 2 months, so that pushes everything out to 2 months. We'll collect that over time. So 2 months' worth of revenue is almost $1 million. And then we can expect some kind of a reduction overall in expenditures as collections in March, April, and, well, maybe not March, but April and May have reduced.
But they're only deferring it for 2 months and it still has to be paid in that 2 month period, at the end of that 2 month period, right?
No, they have to defer it and they can put a loan together to pay it off over time.
Have you heard how much time they'll give?
No. I would expect at least 6 months.
Let's still get it to us by the end of the year though. I'm just thinking budget wise for knowing where we're at.
If there was no delay and simply just a drop off in revenues collected, what would you anticipate that hit looking like?
Taking a guess, 20 to 25%.
So regardless, regardless of the delay, you're anticipating a 20 to 25% reduction in sales tax receipted in 2020.
Million and a half.
Correct. Yes.
Feeling a little better though about the community development. We were worried that that was going to be a drop, but since they're so far ahead of what we budgeted, that might help us a lot.
And you have to remember, community development is supposed to act as an enterprise fund. So technically, the excess revenues there are not for current expense consumption. They should stay within community development.
Yes, but if they came up short, we had to pay for it.
Correct.
Because the employees and stuff, that's how that works.
We look at a 10-year or 5-year balancing that we keep track of.
Yes, okay, so moving on, we'll keep an eye on what the sales tax is doing. Moving on to page 8, the 6-year financial recap. So for current expense cash at the end of March, we are looking at 9.94 million, and so good thing we were sitting at a good place on our cash at this point in time. So that's one good thing out of this. Looking at the budgeted revenues received, again, we're at 18%. Comparing that to the previous 5 years, we're right in there, 2017, 22, 18, and 19, because we're a little bit on the low side there comparing it to the previous 5 years. The expenditures at 24%, right in there with where we've been budgeted.
Wasn't it about 3 years ago, we got down to about 175 at that point, this time of year?
Yeah, it was, what year was that,
17.
2017?
Yeah.
Yeah.
But it was in April?
No, I think it might have been May, if I remember right. I'll look back.
It's still close enough. We're
yeah,
not gonna
it was-
drop that much, it's not possible.
Yeah, looking back a few years, yeah, good thing it happened this year
Yeah.
and not 3 years ago. But, yeah, we were about 2.6, 2.4 million in 2017 and 2018, so it's a good thing that we're a little bit higher. Moving on to the last page, page 9, the special fund cash balances. Everyone is sitting okay at this point in time, it looks like. To me. So any questions on any of this right now? Any more questions? Okay.
So Jen, your item was on the grant writer, was options.
The grant writer.
You submitted something?
Did I
There
say
were,
something?
yeah, there were grant requests and that there are a couple of options.
There are 3 options.
To contract or to hire?
Hire.
Oh, I did not bring a copy of that, I'm so sorry.
Well, and just to fill the commission, and I called Frank and I had asked him about that, 'cause with everything going on right now, there's so many, everything they're deciding to do with us, they're deciding to do it in the form of a grant of some sorts, anything, any opportunity. And it just made sense, our staff that are already doing the grants are already busy as busy could be, it made more sense to do something. And bring in a grant writer, hire a grant writer temporarily or whatever. I myself would be more like a hybrid for, instead of an individual thing, set it up as a temporary employee or something, not a full burden for a year. It just wouldn't make sense to me, but unless we're gonna go back to that, which I do like the idea, but we had had that discussion before. I'd rather see at least somebody that's here all the time instead of just whatever grant we give them. There's gonna be grant opportunities we're not gonna know about. It's gonna take somebody else that does. One of the things to consider is this Federal Reserve and the options that they're putting out for local business or local governments. There may be an opportunity there to borrow some money from them and pay off some of the other debts, like on the sewer, and get it at, a 0.5% or something
Yeah.
compared to 3%. And it should be nice to have somebody that's on here, not just going for that type of grant, but constantly getting every dollar they can for us.
So, I'm really leery about bringing on staff right now, given what the projection looks like.
Yeah.
That being said, there may be an opportunity to RFP for a contract, the grant writer for a longer period of time than case by case.
And that's what I'm thinking.
Just that, I don't want to have to encumber any of the overhead. But there might be a chance for us to take advantage of the opportunity. I absolutely think we need to look at restructuring some of our debt. And that could be a bullet point in the RFP or RFQ or whatever, where somebody who has familiarity with the federal side of things and being able to take advantage of some of that. So I would be interested in seeing what that might look like versus doing a temporary hire where we're still encumbering some of the overhead.
Well, and that's what I actually meant.
Yeah.
When I was saying temporary, I meant I'd rather take them in on a contract for a short term, if we're not gonna do a long-term thing. For right now, just have somebody that's there working for us constantly, instead of just one contract at a time, and paying them $2,000 to $5,000 per contract. I'd rather have them come and represent us for 6 months or something.
And I would add to that a requirement that they come within the RFP or RFQ, that they come with grant opportunities that they have followed up on or they have researched, so that we can utilize some of the federal grant funding that's available and even maybe state grants that might be available in their proposal, to kind of put together here are some of the opportunities that we have available right now to put into a contract.
I like that.
I can work forward on an RFP draft and then present it to the board.
Sooner rather
Yeah,
than
I
later,
think if
hopefully.
there's a way, I don't know what the workflow looks like, but ideally, it'd be nice to get that out next week.
Yeah.
But by the end of the
On
month,
Tuesday?
but I don't know what the workflow looks like. I know there's a lot going on. But is by the end of the month more practical, or?
Or could you do it in the next, because I don't want, first come, first serve on a lot of these grants. If we don't have somebody doing it in the next 2 weeks, somebody else will get that money.
I can be together to a draft of an RFP in front of the commissioners for next Tuesday's action agenda.
That'd be appreciated.
That'd be cool.
You can also give the
And then
authority at least to RFQ.
then you can
if
act
that
on
is
it
out
Can we also give the authority at a certain dollar amount for you just to handle it if it comes in? Because you and I had also talked about other people and stuff that you know of and that may know our county better than others, to give you the ability to bring somebody in at a certain dollar amount or something.
Yeah, we have contract providers that we've used in the past. One got us the opioid money. So there are 2 other grant writers that we've used in the past who have been successful. So 2 or 3 actually. So we maybe can put them together. But we'll put an RFP together and request for the information.
Thank you.
Thank you.
So I guess I'll just,
I think that covers it then, unless we have commissioner discussion.
I do.
Yep, we do.
So, looking at the financial projections, obviously a lot of concern with the, at least the intermediate financial picture looks like for us, and I know we're not, by no means we're the only ones in that boat. I'm sure over at the city they're having a similar conversation, and in other counties across the state too. At what point do we want to maybe look at taking some proactive steps to protect our budget position so that we actually have something to budget with in 2021?
I'd like to now.
I don't know if, I don't know what the range of possibilities look like for us. Everything from furloughs to hiring freezes to you name it. I think, we know what the toolbox looks like, but I just kind of wanted to throw it out there and see what the commission's thoughts were on kind of what we want the next few months to look like so that we know what we're going to be able to do in 2021. So I get the conversation started.
One of the great worries is that we won't have any unexpended budget authority because of the way this is all happening and it's still out there. So I'd like to find a way for us to look at capturing some of that unexpended budget authority for the future right away, because that means those are less people that have to be laid off if we do get to that position, if we can capture that early. Also, the idea of a hiring freeze, absolutely immediately, with the caveat also of not purchasing stuff right now.
Right.
A freeze on all extra purchases that we already have in the budget, and they come to us and ask for, again, and we can look at it and say, you know what, this year, this may not be able to work. I understand it's important, but we're talking people other than this now.
So hiring freeze, purchasing freeze.
Yeah.
I extend that. I know we have already in place a travel restriction based on sort of the public health side of it, but perhaps a longer term travel freeze where, we're not eating into our travel budgets and going to different conferences once the order is lifted. And I think it's, kind of along the lines we're talking about restructuring debt. I think now is a really appropriate time for us to start looking at all of our kind of outstanding copier type leases and trying to really find, where the costs are on the margins there, and that kind of thing. But yeah, I like all of those.
The one problem we have with that, though, to share with you, is because we have a bottom line budget authority, and I'm screaming because, for Frank, just so anybody, bottom line budget authority creates a problem. So if we do find a way to capture that, we have to put together a policy that overshadows everybody fairly quickly, that trumps the bottom line authority, at least for this year. I'm not saying to do it forever, but for this year, so that we can capture that. Other than that, we could say it all we want. But if they already have bottom line authority, they expend it because it's in the budget. That's how it works. So we'd have to find a way to capture that.
Well, you could take it out of the budget. That would be an option.
And that's what, I guess that's what I'm getting at, trying not to say that start a war first.
I would rather take a scalpel to it now than have to ever worry about taking a hatchet to it in the fall.
Yeah.
So if any consolation, the first quarter had a 5% unexpended budget authority in its numbers, as it was reported by Jennifer just now. We could put together a budget supplement or budget amendment requiring everybody to keep their budgets at 95% of budgeted authority from the 2020 budget that was approved in December.
That would simplify things, but that.
Do you think 95% is enough?
It's about $2 million. I think it's about $2 million. Is it enough? No, not to cover, I think, what will be the shortfall, but it's what is in the budget as, I hate to use the term fluff, but what's in the budget now as unexpended budget authority. Generally, the departments can handle that without too much difficulty. If you went to 10%, now they would have to make some adjustments in order to accomplish that.
No, but now, as we know, if we were to do it in that manner, we do know that there's certain departments that have never given back that much. Some have, and you can count on it. And that's one of the things that in his scenario he was talking about was capturing that unexpended budget authority. The year we had that one bad year, not only did we have, you know, that one department that promised us all this money and then stopped it, and then we had the certain state entities for logging that stopped that part. On top of that, that was a weird year where the unexpended budget authority, for the first time ever, disappeared. That's why we shifted things a little bit so we could, everybody had learned to use it too well. There was nothing left, and we lost all the money, and that's one of the scenarios he was talking about. If that disappears, this would at least capture that. But I don't think it'll, we still should talk about the other as well. The idea of stopping any purchases of other things and on top of that.
At 5% is a county-wide average, and obviously some departments are higher, some departments are lower, but that's a county-wide average. So would you like to have a draft of some sort of a budget adjustment or some sort of a document that can be adopted as a budget adjustment to require each department to come up with a 5% reduction?
I hesitate to do kind of an across the board thing. I would much rather us work directly with the electeds and department heads. Number one, institute that hiring freeze, institute the purchase, restrictions, and let's see how far we're able to kind of offer things up at that point. We know we're going to get a little bit of a pinch. We have the reserves. You know, we can weather it, but I mean, we have to be able to do this in a collaborative way. That this is about protecting our position for 2021, as much as it is trying to get us through the next couple of months.
And I want to remind you, we've done that, been there and done that before, and that exploded. That did not go over well for the county. That was where the war began. And if we can do it in the other manner, I'd rather do it without the war. We're all in this together this time again. If we do this early, and especially if there's a hiring freeze, automatically money will start to amass if we can capture that money. And then with the idea that in 2021, things are normalized, we have the cash available for them to go right back to business as usual the next year, or at least darn close to it.
So what I'll do is start a conversation with each of the and come back with what they can and can't and how we can work towards reductions in 2020's expenditures.
But not just can and can't. We need to know, we need to start a process where they're not buying any equipment or anything right now. That has to be established, not just what they want to give up. That
could be a quick conversation.
Yeah, we establish it the other way first. Then if it's absolutely necessary, they can come to us, and then we say, I agree with you, that's 100% necessary, we have to have it, and go back out that way. I'd rather capture it first and then have.
Yeah, and so on my list, I have hiring freeze, purchasing freeze, travel restrictions on a long term for travel budgets, reduced travel budgets, restructuring debt, looking at copier leases, costs and margins, and then use that as a basis to start reductions across the board.
Do you and Jennifer have any other things you'd like to throw in?
Not at this point. I'll get a hold of you later, Frank, and we can talk
Yeah,
about.
okay. I can't think of anything else at the moment as well.
I know one department is going to get a little extra help from the state to help with elections. And so I think it's definitely something that we need to do department by department.
Well, and also keep in mind, if we get this grant writer on board right away, they're gonna go after money for law enforcement and anything else that has to do with the COVID.
Right.
If we're smart enough to have somebody to take advantage of all that, that can offset a lot of the other things, but then we can talk then about how to spend the money that comes back
Correct.
after it's in, but first get it, I guess.
Yep. And we do have some funds that we can recover from the Family First Act.
Right.
And we have absolutely no clue what those reimbursements are going to be as of today.
Actually, though, I'm thinking about it, 'cause I just got done reading it again, what you just gave us, I was reading it over and over again. That's gonna be a pretty substantial amount if we capture a lot of that, which it says, if we can get them to reimburse it, but they'll probably do that in the form of grants too, which sucks, but that's gonna be substantial.
I think a lot of it is reimbursable through the COVID.
But somebody's gotta apply for it though, is what I mean.
Yeah.
That will be reimbursed by reductions of payroll taxes. So instead of us paying payroll taxes, we'll get a reduction in payroll taxes as we go forward.
How do you do that with 2/3?
2/3.
Well, if they're gonna cover 2/3 of something, how are we gonna cover that with payroll taxes?
That is their proposal. It's going
how
to
do
be
you get it back?
a reduction in payroll taxes up until we collect back our 2/3.
So we're talking, this could be a several-year process for reimbursement.
Multi-year, yes. Multi-year, yes.
Okay. So it helps us in the future, just not today.
immediately.
So we still gotta survive now.
Yeah.
But I still think even if we can capture a lot of that, that's gonna be a lot of money.
So Jennifer and I will work on a proposal and get back with the board on what options are available and how we could move forward with that.
I have one more thing, but I didn't see it on here. I called you and asked you to bring forward the issue for the veterans, the $5 grand,
I'm sorry, I forgot about that.
and you guys have never seen the proposal, right? Okay, nothing we can do. Could you send it off to them? Just to fill you guys in, there was different entities, as you know, one person that's a little mad at us right now, but Steve at North Mason Resources has agreed to administer North and South, the funds for both of them. They keep them separated and still administer, so they can still get it, and you only have to go through one contractor, basically, rather than two, because originally we were talking about two different entities, but it's still the same people from here, they just get the money administered out from Steve, and April Pooler and all them are on board with that, just to share that with you. But you still gotta see the paperwork, so if you don't mind sharing that with them also, because they're all on board with it now.
Okay, I apologize for not bringing that up.
Happens.
Anything else? Yep, we have a lot of work. I will get back with you guys on documents for all of those.
There might be something coming, I just thought. They're talking about releasing prisoners. And so I'd like to get your opinion on that, the DOC is. And so whether we want to send a letter to the governor or have WASAC do it or what, as far
Well,
as.
because they're gonna drop them off here in Shelton, I would love to send a letter ASAP and have it on Tuesday's agenda.
Yeah, I mean, first off, I'm not even sure how they're gonna do this, but logistically, on its face, it's concerning at best. You know, typically, as you all know, you're released from prison, you kind of get into you're on a track, then there's help with potentially housing and getting
Right.
kind of the reentry part of it. Any of that a part of this? I mean, or is this just kind of a
As far as we know, no.
catch and
They're
release?
just,
kind of, I mean,
they're just going to release them at a certain,
yeah.
And they'll be able to get on the free bus and come right here to Safeway.
Well, and I think, you know, our social services are gonna be strapped here locally.
they're already
Um,
strapped,
yeah.
and that, you
You know,
you
that-
add that extra burden.
Yeah. So I'm 100%, let's.
Tuesday, you wanna ride?
Go right in.
No, you're the best at it, that's. I will if nobody else wants to, but
Yeah. I tell you what, we'll do up a draft, and then we'll send it out, have you guys take a look.
when you're saying we, does that mean you?
I will draft.
Thank you, awesome.
Thanks.
You just sit with your mouth shut for long enough.
Yeah.
That's all I have.
Good one, though.
Thank you, Frank.
Okay. Thank you, Commissioner.
Ciao.
Thanks, Frank.
Thank you. Take care.
Bye, Frank. Let's see. Now we've got, I think it's Dave.
Yep.
You want to do it from there, or you coming up here?
Yep.
You're limping.
Yeah, I got a little behind on things. Okay. So do this. Basically, we're just gonna go over where we're at right now with the COVID response and then planning assumptions.
I remember this. Looks
Mhm.
vaguely familiar.
You guys drive me crazy with the corner staples though, man.
Well,
Just don't work out.
So just take and do this, just hold it up like that, and just like that. Yes, I do. Okay. Can you reintroduce?
Oh, yeah, we did have. Thanks. All right, moving on to community services, go around the room for introduction.
Kevin Chudy?
David Callen.
Mike Collins.
Dave Windom.
Randy Neville.
And Sharon Trask.
Okay, it's been a busy several weeks. So I want to run through this document pretty quickly and then come back and hit the stronger points. So we'll kind of buzz through this. The background on this document is I digested a much larger document that I got from the state on the things that the state and the feds are looking at in relationship to COVID and what a return to normal might look like. So this was a document that they were reading, and I just kind of broken it down into something that's a little more manageable here. So they're looking at a 4-phased approach. Currently we're in phase 1, slow spread. Phase 2 is a state-by-state reopening. 3 is lifting the physical distancing completely. And phase 4 is readiness for the next time we have something like this. So we'll spend most of our time talking about phase 1, phase 2, and a little bit of phase 3. Phase 1, we're already working these things. We're slowing the transmission. We're seeing that already. Increasing testing capacity, that is something that's coming from the state. We're not quite there yet. Ensuring that we have the capacity to treat both COVID patients and others requiring care, we're there. We've got that capability in the community, so we're doing pretty good on that count. And then, of course, the last one, the goal of that is all to save lives, and I think we can see that by our low rates we're having here in Mason County. So I think phase 1, the main goals of this, we're hitting them. Phase 1, steps required is this document with all the different steps. And these aren't in any particular order. These are just things that are factors that we're looking at. So maintain physical distancing, increase diagnostic testing, which is obviously that's the next big thing we're working on. Data infrastructure. So the state has had problems with its data infrastructure. As we've seen, they've crashed a couple of times in WDRS, which is this Washington Disease Registry System, crashed over the weekend. And they've had to take out putting negative cases into that because there just got to be so many new pieces of data that the system wasn't holding up. Locally, our system is working pretty well, but we generate ourselves and kind of run ourselves, and it works pretty well. ensure a functioning healthcare system. I think we're there. Between Mason General and our other partners, we've got a functioning system with enough capacity in reserve to handle anything that we've got that may come towards us. We are working on increasing our supply of PPE, so we've almost doubled what we've had in the last couple of weeks, to include putting some out. Just as an example, the sheriff's office had an order that came in for the sheriff's office for the jail, and that was their piece. But we've had a lot of donations, and stuff's kind of coming out of the woodwork. One of the things we're doing is we're taking some of our oldest stuff, using it first, and taking our freshest stuff and putting it to the back, so to keep that stock rotated.
We should receive a small shipment today.
Right, right. Comprehensive COVID.
Which will be on TV.
Yes.
So, it'll be channel 7, I believe.
So, I just hope it's not a guy who comes out of a truck with like a stack, you know.
What do you mean it's on TV?
Well, they were asking for, a lot of people, so people are getting shipments, but a lot of these other places do not want to be on the television. They don't want to be seen that they're getting anything, is how I took it.
Mm-hmm.
And so they contacted Mason County because they heard that we were going to get something, and our PIO said, sure, we'll do it.
So I'm gonna be like a pallet.
Right, won't be a lot.
It won't be a lot.
But anything helps at this point.
Right, right.
And it's mainly, I think, gloves.
Yeah, 3 different sizes of gloves and some sanitizer wipes. So, and gowns.
And gowns, which they're gonna contact the hospital to see if the hospital needs those gowns,
Right.
because the hospital is short.
That is the one thing the hospital is shortest on. So we do have those things coming in. Surveillance, that's being run through public health, and they're doing a crackerjack job down there of staying up on top of the case investigation and working that piece through.
I went over Friday to talk with our nurses. They are amazing. And the people that they contact, they develop a relationship with them. And it's just, it's so cool to see and to hear them talking to the, not just the patient, but the people that they had contact with. You know, they're asking them if they need anything, you know, how can they help, and just, you can just feel the compassion that they have for all of those people that they're talking to.
And some cases are very simple. Some cases, they've known and they've self-quarantined and they got their test and they've done everything right with next to no contacts. And in other cases, there are a slew of contacts, and it may take all day of doing interviews to get, to try to trace all those contacts.
But at least we're low enough on how many we have that we're able to continue to do that. Other places gave up.
Right.
You know, even things I'm hearing the kids have, they gave up a long time ago.
Yeah, and
Some
some,
may be trying to contact a few, but
some LHJs have given that over to the Department of Health to do for them, and we decided that was really not kind of the Mason approach to things. So we're doing our things ourselves and actually maintaining those personal interactions. Massively scaled contact tracing, isolation, and quarantine. Massively scaled, but we are scaled up here in Mason County, so we're doing okay there.
Massively scaled.
Yeah, and that's again, this is a federal and state document, so
And Mason County is special.
yeah. Offer voluntary isolation quarantine. We're a little behind on that, although we had contact last week with Peninsula Healthcare, who has some systems in place, especially for North End. 10 minutes from Belfair, they have a couple of facilities that are available for people who have been exposed and don't want to go home. So they have a place for them to go home and not take it back to their families. So that's working pretty well. And encouraging the public to wear masks. I have seen all kinds of masks. So people are out there wearing masks. They're doing their thing. An important thing to note on the cloth masks prevent you from giving it to somebody else. They don't prevent you from, so we'll come back to that when Frank and I have our discussion about what the county is going to do. Triggered move to phase 2, which is partial reduction in phase 1 steps. And this is, you'll notice that each of these has and. So sustained reduction in rates for 14 days and local hospitals can safely treat all patients without resorting to crisis standards of care. No one has gone to crisis standards of care, so we're doing
Say,
good there.
we should never went to stage 1 in the first place, according to this.
Well, and the capacity exists to test all people with COVID. Well, we're not there yet. And capacity to conduct active monitoring of cases and contacts, we're there. So we're really kind of looking at the first and the third. Once those kind of roll in, we'll start looking at that. And that's statewide, but depends on how the governor does things. Phase 2 goals is, of course, is to lift physical distancing, allow the vast majority of businesses and schools to reopen, and then continue to control COVID-19 so we don't go back to phase 1. Trigger to lift physical distancing is incremental in distancing measures. This could be done gradually, should be done gradually with increased surveillance for new cases. Restrictions eased with sufficient time between each adjustment to monitor for resurgence. And what I talked about this week was if we put construction back on and we use construction as our test case. Construction goes on, we monitor construction, see what that does to our rates. If there's no changes, then we add the next thing. So, but it would be a good test study in social distancing and where we're at with cases. Okay.
That process, though, would take a long time. So if we waited for it.
Within a couple of weeks, I think. So trigger for return to phase 1, that's what we're trying to avoid. Identify a resurgence in number of cases for 5 days. A substantial number of cases that can't be linked to known cases. So if they're linked to a known case, we expect them, that's fine. But if it's one that just pops up out of nowhere, that tells us it's still loose in the community and we want to watch for that. And then hospitals are no longer able to safely treat all patients requiring hospitalization. We've got that one down. We have plenty of capability right now. Mason General is at about 50% of their bed use, and they have the ability to add at least 20 more beds. We have the ability through public health to add 60 more beds, not including what we've done at building 10. So we've got plenty of capacity right now. So in the state, you're talking a total capacity in the state of about 4,900 beds, and we're using about 15 to 1,800 right now. So there's capacity in the state system as well. So,
at what phase do you think they would start to allow for other procedures in the hospital again?
That's one of the things we talked about this weekend. We had a discussion with Department of Health on Saturday to talk about at what point can we relax thinking, get the dentist and elective surgery back working again. And that's going to really kind of come down to PPE, I think. PPE and testing is the part that's going to turn that back on. But that's certainly high on the agenda is to get those things rolling again. Steps required in phase 2, implement case-based interventions, we've got that. Begin to relax physical distancing measures. Special care for vulnerable populations, and when I put that in, I have that in mind. State does too, but I've given it a little more thought. Food banks and all those infrastructure pieces that are being stressed right now, how do we make sure that those populations are taken care of, and how, do we know what they're doing, and then do we know what they need? So that's part of what we're doing this week, is to try to nail some of those things down. The next two are really coming from above, so accelerate the development of therapeutics, chloroquine or whatever they come out with as a treatment, that's going to come from above. And identify those who are immune, and we can't do that without getting the serology out there. We're not at that point yet.
How long before we can get that test, the 15-minute half-hour test?
Well, the 15-minute test is here. The problem is the throughput on it is one test per 15 minutes. It's not multiple tests. So there are a number of those tests.
But for us, that's incredible.
Yeah, but a number of those boxes have come out, and they've gone, I think, to Seattle, to Snohomish.
But we don't have them.
We don't have them.
That's what I meant. How long before we can get them? Because we can't.
I don't know. There's 15 boxes that have come to the state so far. So we don't have that capability yet.
Do we have anybody trained to do it?
As soon as it's allowed, Mason General will have their lab certified. So, but of the portable boxes, there's only 15 of them, and they're scattered across the state. Okay. Those who have been identified through serology will be able to return to work, and then especially work in high-risk roles. So your healthcare, firefighters, EMS, law enforcement. Those folks want to look to make sure that they have the serology test done quickly. And then serve in those roles, like I said before, food banks and all those other things that keep our society functioning. We need to get those folks tested to see their serology as well. But again, that comes from above. Phase 3 goals is prevent infection, treat those with early disease rapidly. So if we have a positive case or cluster, we jump on that right away. Prophylaxis, that's going to come from above. If vaccine is available, that also comes from above. And the final goal is to enable the lifting of all physical distancing measures, and I put a little guy having dinner out with his pizza and beer or whatever there, so just to get people back out doing the things that they like to do. Thresholds for action is to trigger up and begin a scale of vaccine and therapeutic. And as soon as those are in and we've got the priority populations taken care of, switch towards the mass vaccination. Steps in phase 3 are just like they were with measles or any of these others that we've had in the past. That's produce it, prioritize it, distribute it, and then determine if it's working. It's pretty simple. And phase 4 is to come back and rebuild our readiness time around. And we're already talking about how many masks would be appropriate for Mason County to keep in stock. We're going to come out of this with masks and cots and bedding and all those things for shelters that we can stand up, and we'll have those, we'll be able to put it back into storage. So we'll come out of this in better shape for anything else that comes along, whether it's a virus or whether it is an earthquake or a fire or whatever. Anything that displaces people and starts to shut down systems, we'll be better in shape for. So I'd like to roll us back to this page. So this is my focus for this week, is to look at these at the state level and basically take each of these and make a plank. And off of this plank, we'll have what are our assumptions. So if the governor was to return us to, and say, all right, we're going to start relaxing one or more things, we don't know what order they're going to come in. So the idea is to build a plan and a can for each one of these things. So that no matter what the governor decides to do or the president decides to do, we'll have a plan of action, and then we'll have a planning assumption and then a list of concerns that would go along with that. So this is really at the state level. We'll get this done in the next couple of days. The next thing is to take this and expand it and look at what does this mean for Mason County, all the counties. So that will be a discussion with us, with the city, other parties, master builders, whoever. So at construction, for example, we had a plan for construction. Construction comes back, what are the assumptions? And those could change depending on what the governor does, but let's look at the assumptions and then what's going to be the reaction that we're going to have to do. What are the things we're going to have to pass, we're going to have to get done and get out there to make that thing work. So have a plan for each of those. And I intend to meet with the city and other partners this week. Commissioner, we're here. I went backwards in time. So, again, this is the state level, and I just went through this, but what we want to do is build a plan and a can for each one of these things. And then we're going to add to that based on what we know Mason County would need. So, after we meet with the city, have a much bigger discussion inside county government. So if construction gets turned on, what does that mean to the local government? How do you bring back all your building inspectors? How do you bring back the front counter? We've got new systems we've been using. How do you integrate those new systems into what the new paradigm is going to look like? What's it going to mean for the assessor, for the treasurer? All those folks will need to go through the same things with each one of them and figure out what the county plan is going to be. So as Frank was talking about earlier, so if we bring county employees back, what's the PPE requirement going to be? If we assume that we stand up the whole county at the same time, or do we assume we're going to stand up like a rolling reopen? And then if we do a rolling reopen, say the courts open first, what does that mean? County government opens first. So we'll be working on that later this week, so we can have something a little more pinned down.
And hopefully it'll make it harder than it has to be. If we have a real drop as it's looking like that we're having cases right now, if that can continue, that it'll be self-explanatory. If you've got 1/20 of the positives that are happening, than what we even had when we started, it shouldn't be that hard, so I
Right.
just hope we keep things simple.
No, our idea is to keep it simple, but to have a plan ready for whatever is relaxed first or in whatever order.
Right, I know some departments are already looking at theirs, so I don't think it's gonna be.
I don't think it's gonna be that
It's not
tough. No. But just outline each plank and then assumptions and then reactions.
I'm from the government, I'm here to help, and I'll figure out all your problems.
Well, we had that discussion, that very discussion on the phone this weekend, and it was a very robust discussion. And there are those who would like to have public health determine what businesses come back at what time. And there are others who are saying that's probably not the right approach.
I don't know, in this county, I'd be appreciative if the government would listen to that. I'd be happier than heck.
But it's all gonna hinge on what the governor allows to relax and in what order. So, we're preparing for that, and we've got the planning piece working on it. This week, we're gonna be really hitting some of those things like the food banks and other infrastructure pieces that we need to have in place regardless of what happens. You know, if this thing drags on, we need to make sure that those pieces are taken care of.
You know, that test that keeps going in my head, please look at options and bring us back an option. It may be valuable just to us as a county to find a way to invest to purchase it if that's what it takes, or something to be able to get that test mechanism here. Instead of waiting until it trickles down to our size or our...
As it gets approved, Mason General will have the ability to do rapid testing, but they have to go through their pieces first. So there's two separate things, and I think maybe we get them confused. There's the box, that will do one test at a time. It takes 15 minutes. Actually, it takes like 7 minutes to get a positive and 12 minutes to get a negative, but it takes a little while to process, and they only do one test at a time.
So if we got one an hour, I'd be happy, to be honest with you. We only have so many that we have to test, and after a while that becomes
Right,
novel.
and as more of those things are produced, more of them will come out. But right now, the state has gotten 15 of them, and they've been distributed per the Department of Health. They've decided where those go.
And more of those are sent to the hardest hit
Of course,
areas.
yeah. That's why I want to jump in front of them.
Yeah.
Oh, believe me, we're trying to jump in front.
Yeah.
Just keep an eye, if you see an opportunity, if it's financial, or sometimes it's not even going in the regular line of doing things.
I think our best key is if the lab at Mason General gets certified, and they can do them you can get the samples in the parking lot, and can do 35 a day, and get them done in a day, that's going to be a huge increase.
And Peninsula may even actually be certified before they are,
Yeah.
so we can.
Well,
also go
Peninsula's
from
sending
north to
all
south
theirs
as
out.
well.
Yeah.
Peninsula's not doing it, they're sending all of theirs out, but yes, it'll be through Kitsap County. So I think they send all of their testing through Harrison.
Yeah.
And the Harrison lab I'm sure they're gonna stand up like Mason General.
But probably a lot sooner. That's what I'm talking about. I want to get the opportunity, first opportunity we have, I want to jump. I don't want to wait for it to come to our size. That's.
No, we're working on
Oh,
Yeah,
yeah, it's full steam ahead.
it. Yeah,
yeah.
no, it's stuff we work on every day up there. So that's where we are in COVID.
You have one issue you need to figure out. For the last 5-6 days, you guys have been at odds with the state. You have 18, they have 19.
Well, yes, so WDRS went down over the weekend, and so it got inputted into the system, but it didn't transmit to us. So
we have 19.
So we have 19. So
So did we get it today, or?
we got it today.
Okay.
So and part of the problem is the State Public Health Lab is not entering into
It's a nightmare. I
it's
follow every day.
their
5 times a day.
own system. They're not entering it in. The lab results from the public health lab aren't going into WDRS, is my understanding, until 3 or 4 days later. So where the other labs, we're putting them in the same.
And for some of the other information, we were stuck on the 3rd, then it broke loose, and it brought us all the way up to the 5th.
Yeah.
Right.
No, it's the state data infrastructure was not prepared, I think, for the amount of data that would come in through something like this.
And we spoke this morning about the tests that have been done, they haven't been tracking the counties. And so we may get an influx of positives because they were not, they didn't
Attributed.
have, yeah, they didn't have a box on there saying, asking them what county they were from, so they didn't put that information in.
So they're trying to track down by address.
Mm-hmm.
And so there's, I think, 1,000 cases out there right now that have not been attributed to a county.
Yeah, but that doesn't bother me as much because you were like that anyway, and then it got down to 63, and then it was back up to 800, and it was down to 124, and then, you know, now we're over 1,000. So hopefully, we don't have that huge influx.
Mm-hmm. Yep. Anything else?
I think that's it. It's been busy, so nurses are doing a great job. EH is helping fill the gap, and they're doing a good job. You know, it's just, as in any emergency, it's always logistics and data. Those are the two things that always hang you up.
Mm-hmm. Yeah, no, your group's doing amazing. They're putting in lots of hours.
Mm-hmm.
Well, this is the first time we were backwards from the state, usually the other way around.
Mm-hmm.
We were always, you know, telling people, no, you can't listen to what the state says. I know that we have one more than that. And this time it happened backwards.
Yeah, so it's just the vagaries of data systems, and you go with the best thing you have and run with it. Anything else for me?
Nope.
Okay, cool.
Thanks, Dave.
You bet.
I still do my email, I'm just curious.
What?
I was in time, although I realize now I'm looking at the clock on that side too. I don't ever sit on this side.
Good morning. Mike, how are you? You say good, but it doesn't sound good.
All right, we're gonna move into our public works briefing. Same people are in the room.
Everybody.
All the people.
Aye.
Yes. All right,
First thing on the list is the annual construction and the 6-year tip. So we want to have a public hearing to make some adjustments. I think they sent you out some reasons for the amendments, but I'll go over them. That we wanted to add a 2020 county overlay project because the SDP funding became available, additional funding. So got to put that both on the 6-year and the program. The Harstein Island Bridge, I believe we got $3 million to do the resurfacing on that structure, so that gets to be added. And then the clear zone improvements there for Arcadia, there's like a list of 5 different roads. That's safety enhancement money, so. And then they got a couple of milepost corrections for the Uncle John's upper and lower culverts. So those are just kind of some housekeeping things.
Because I don't have anything on here. Is there anything that they are taking off the list because of the delays in being able to do anything?
No.
Good.
We're not taking anything off. Most of the
I've got one in particular, the Clifton Road.
Yeah, a lot of, with the construction project, we already have the one out for bid that's been awarded to Miles Resources. So that paving project's getting ready to activate. Matter of fact, I want to talk about that. But the 2 culvert projects that are going to be done with county forces, Shelton Valley and Deegan, we're going to move forward there. We have the one pipe purchased already, the other one is about to be ordered. And so we're going to be ready to do those projects come July 1st. Well, July 6th, we're going to wait till after the 4th of July. So make sure we don't get too far involved there.
Isn't it the 4th of July in Hoodsport right now?
Yeah.
And I wish we could help those folks. Go ahead, sorry.
So the essential work, that is what I want to talk about with Miles Resource. They've reached out to us. Originally, when we had a pre-construction meeting with them, they were shut down and they were held, their employees all go home and the same as we were. But now they've reached out and they want to start on the 20th of April. We did some investigation with the local programs, WashDOT and stuff. Counties do have the authority to deem that essential work. There's an example, I got one example here from Pierce County. Down here.
Yeah, I'm not sure, I already thought we did anyway, from what I've read, so.
Okay. And
Just our determination.
so, you know, basically we were looking for the board's support to write something to Miles and say, yes, we think you should move forward with your job. We think it is an essential function.
If it's anything like DCD, I think the director themselves can actually
Yes.
write that.
Yep.
I'm okay with it.
Okay.
Yeah.
Okay. That's, you know, there'll be less traffic during this period of time, and we're also concerned about if they move on to some other projects, maybe they won't come back to us for, you know. too
What I was
long.
worried about.
Yes, and that's also going to give us a training opportunity for our road crew. We'll be able to bring some of the members there for paving, because we have our own paving machine, going to be doing quite a bit of that here lately. So we'll get them with the experts, so to speak, and give them that exposure, so.
Don't use the word exposure.
The other thing we're looking at is with the road crew itself, is trying to get them to coming back to work. We're projecting like the 27th. The ideal is we have a lot of activities, boom mowing and sweeping roads and graveling roads and different things that we can do to separation, you know, requirements. And other counties, it's just kind of really extreme. You look at the other counties, some are not at all, some have never stopped working. So we would like to, in some way or fashion, get some of them back, or most of them back, if not all of them back, in doing this process. The road supervisors and I have been working on different scenarios to do that.
As long as it's safety, I don't think there's any issue at all. You know, and even sweeping the roads, it has to be done. You know, the safety of those rocks that are on there that have to be moved off.
Yeah.
You know, maybe brushing might be an issue, I don't know. But.
Well, they got 6, you know, a perfect example is they got a half a dozen boom mowers. And so you can put 6 guys in boom mowers and you have 6 guys in vehicles flagging behind them. There's a dozen guys right there out of the 27, 28 that we have.
Just make sure you go with the protocols that you guys told us in the first place, different vehicles to move
Yep,
them out.
absolutely.
Bring them in at different times.
That's the whole plan. They were talking about starting 15, 20 minutes earlier, half the guys on one shift, half on another, different things like that. So, and actually meet, instead of all meeting in one room, meet in a couple of different rooms to send them out. So it can be done. We're confident it'll be safe, guys. So we may have a little pushback from some of the members, but we can deal with that. I think that's about it on that. Shiprock is being delivered. We have the salt shed. We've got those plans, PSEs ready to go out to bid. So we should be okay on getting that constructed this year. I'd really like to push to get that Tahuya Estuary Bridge, where we have the plates there. We've got a design from Sargent Engineers to a rough design to do sheet pile on the approaches to hold from the scour that's happening there. So I'm going to work through that, try to get that done this year too.
Is that Dewey River Bridge on the part that's on the Belfortunia Road? Is that coming out again?
It's on the North Shore Road. It's almost at Tahuya there. It's called
down on the North Shore Road.
Yes, it
itself.
is.
Okay,
Yeah.
that's a different one.
Yeah.
Because we've lost the other one twice over the years.
Oh.
Remember how? Yeah.
Well, this is reviewing the bridges. This is the worst case scenario that we have, and we'd like to get that. It's a safety item.
Now, the Salmon Enhancement Group up there, the Hood Canal Salmon Enhancement Group, they were looking at getting some granting for doing some of that work. Are you working with them?
Yes, I've been reviewing all the data on it, the history on it. They actually originally want to put a 700-foot long bridge in there. but they don't have any funding for it at this point in time, so this is
no
something
choice.
we're just doing repair of existing, so.
I wonder though if they don't have any funding because we weren't active with them on
That's
that.
possible, I'll find out.
Please do.
So,
It'd be nice when we get money from somewhere else.
yes, it's really nice when we get money.
Oh,
And fish is a big thing when it comes to money. So, that's about it, unless you guys have some questions. We've had a long morning.
Yeah. I just have one quick thing. I heard from a couple of folks out on Reller Road and Highland Road. You can maybe take a look at, they were asking for like a safety mirror or something there, and they've been having issues pulling out. But if we can maybe take a look at that intersection and see what we can do.
And Highland and,
Reller, R-E-L-L-E-R.
I'm learning them.
Yeah,
May just be a line of sight issue.
just south of Bushy Road.
Yep, okay. We can do that. Anything?
Nope. Thank you very much.
Thank you.
Thanks, Mike.
You have a better afternoon.
You too. I got an email from Jean Gray, and she said she had talked to you about a dumping area. I just wanted to know if you
Yeah.
had.
What I told her right now is the chances of us doing much right now with no crews or anything doesn't make much sense, but on top of that, it's actually on DNR land, and we have to get some type of thing from DNR. They should be doing it, or paying our folks to do it or something. We can't just go on there and start taking it. That's my opinion, but in the past, that's been an issue. When she calls, it'd be nice if we could just send our crews to do everything everywhere, but it has to be on our property.
So it is DNR though.
That's what she told me.
Oh.
I asked her and I said, you know, and, well, it is DNR. I said, well, that makes a difference. We can't just send our crews out into DNR land. But she's gonna give me some other pictures and some information. We'll find out if it is an approach. But no, that's all I have.
All right. Well, if you need anything.
Yep, yep, absolutely.
Well, right now, you know, with kids that closing their stuff down there, that's when it started dumping. They just started taking advantage of it, so,
The kids have opened back up, so
yeah.
thankfully.
I should have asked, well, I don't know if Mike would have even known. Was the opening up of our recycling just for that one day only?
No.
Okay.
It's open.
Okay. I think there was some confusion out there on the wording. But
Yeah, no, it's,
yeah, I thought it was
yeah,
open.
yeah,
Yeah, open.
yeah, open.
I'm so proud of our staff for even being able to find a way to keep making it happen. All these people that would call me to complain, it's like, yeah, you know, I'm not a Kitsap County Commissioner, right? You know that, right? You're Mason County, why aren't you
Yeah.
using ours?
Yeah, well, I'm glad they got it, I'm glad they decided to open back up.
Yeah.
Wise choice. Anything else?
No,
I think we're good.
No?
that came up. I move we adjourn.
All right,
Second.
we're adjourned.